I'm Jared Feely.
And I'm Sandra McCarthy.
Thank you. And thank you for logging onto our webinar this evening. So we want to say a little bit about ourselves. And first of all, from the next slide, you'll see that there are 8 organisations associated with this project, including University College Dublin, Care Alliance Ireland, St Vincent's University Hospital, and several other associations and organisations. And I should say that we are funded by the Health Research Board and Atlantic Philanthropies. A little bit about the project team that's been involved in this project over the last almost 3 years now. You can see that there are 8 people involved in the project team, and that includes myself and Sandra, and also other people mostly from University College Dublin and Care Alliance Ireland. Our team also includes a group of family carers who have worked with us over the past 18 years, and we say a little bit more about that as the webinar progresses. Why are we here this evening? Well, we're holding a number of workshops throughout the country, and the overall aim of our workshops is to communicate information to family carers and others who have an interest in the subject of dementia, caring, and resilience. In an effort to further spread our research, we're conducting this webinar as a way of allowing family carers across the country who would not have had a chance to attend our workshops to date in person. And while practical information will be included in this webinar, given the limitations of the webinar setting, the focus will be to share our research and also demonstrate our newly developed online resource. The aim of our webinar is to share with you then what we have done over the past 2.5 years and what we've learned about resilience and caring for somebody with dementia from our research and from other research that we've looked at as well. These are the things that we will cover in our webinar this evening. The objectives are to describe what is currently known about resilience and caring for someone with dementia, to describe the results of a survey of family carers of people with dementia in Ireland, which we completed in 2016, to describe how we went about developing a resource for family carers of people with dementia in partnership with family carers, to describe some of the main features of the resource, and to highlight why the topic of resilience is relevant to caring for someone with dementia, and finally, to provide you, the webinar participants, with the opportunity to give some feedback. So, why did we study this particular topic? I should say that by the end of the webinar, we will ask you to complete a short survey, which we will send to you via email. You should have also received a brochure, an online brochure on the book of the booklet that we've developed to accompany this webinar series and also our workshops. So, why did we study this particular topic? Well, some of you may know that the government launched the Irish National Dementia Strategy in 2014. The aim of the strategy is to address dementia at a national level across 6 different areas. And these 6 areas were as follows: to have better awareness and understanding about dementia, and this is the Understand Together strategy, and also to a timely diagnosis and intervention, particularly about developing local care pathways for dementia, to focus on integrated services, supports and care for people with dementia and their carers, and this includes looking at ways to support family carers and people with dementia in the home and in the community through home care packages and so forth, to provide training and education, to conduct research, and to promote leadership. And in terms of the research, an aim of the strategy was to get better information and data on the needs of people with dementia and their carers, as well as determining what works for family carers and people with dementia in terms of support. And so we are one of a number of projects that have been set out to examine these issues. In particular, as a research group, we have focused on the needs of family carers. So what does the strategy say about carers? The strategy recognises that dementia care can have a negative effect on family carers, on their health, their mental well-being, as well as the social and economic impacts that it can have. Our research is interested in what can be done to help family carers weather these adverse effects. When people can cope with the negative impacts of a particular situation, we call them resilient. So we wanted to know more about resilience and how could resilience in family carers of people with dementia be enhanced. So our project had three main parts. Part one, we wanted to know about resilience among family carers of people with dementia. So we did what we call a systematic review of all of the available information on this subject, and we then assessed it. And we were also looking at the quality of that information, and we also wanted to know about family carers in Ireland at the moment and what helps them to be resilient. So we did a survey, a national survey of family carers of people with dementia. We also, armed with this information, we also set about developing a resource to support family carers of people with dementia and ultimately to enhance their resilience. We wanted to know more, to look more closely at what resilience means to family carers and what helps carers to become more resilient. Family carers were invited to come together and work with us, the research team, over a year and a half to develop and design a resource to support family carers. And so it was a resource for family carers by family carers, and we'll talk a little bit more about this later in the webinar. And finally, in part three of our project, we set about to make sure that the resource which we've now developed and designed works and that it is of a good quality. So we're currently working on evaluating it. So why is it important to learn about resilience and caring for someone with dementia? Well, we know that caring for someone with dementia is very challenging and can have very negative effects on carers. It can affect their health, can have negative social and financial effects. It can affect them socially and can negatively impact on their well-being more generally. But we also know that many family carers do okay despite these challenges. They're able to bounce back and cope with the physical and psychological demands of caring, and some describe caring as a positive experience despite the challenges. These carers are said to be resilient. And not a lot is understood about what makes some carers more resilient than others. But we felt that if we could improve our understanding of resilience and caring for someone with dementia, it could help us to develop a resource that could enhance resilience among family carers. Ultimately, this would enable family carers to recover from or adapt to the challenges of caring for someone with dementia, which in turn would mean that people with dementia could remain at home for longer if desired. So what do we know about resilience and family carers? We know that when a family carer is more resilient, she or he has the resources to counterbalance the negative effects and hardship and make positive adaptation to the demands of caregiving. Carers who are resilient are able to use their internal resources to make better use of external resources like health and social care services or social support networks to help them cope with the stresses of caring. So if carers can be more resilient, they will be more connected socially and more resourceful in accessing services and supports, thereby reducing the burden and isolation of their caring roles. So at this moment in this webinar, we'd like to pause for a moment and see if you have any thoughts about what resilience means to you as a family carer. So we'll ask you to type in some questions or some answers or some comments in response to that question. What does resilience mean to you as a family carer? We'll give you a few moments to type in your questions. Will I proceed?
We'll give people a few more minutes,
Few more
maybe.
minutes,
I
yeah.
think, are there ones coming in? Can you see? Or no? Okay.
Okay.
Might give people one more minute and then we might
Yeah,
move on.
we continue that. Yeah.
We can always come back to questions at the end as well if people find they have more time at the end to
Yes,
type in something.
indeed.
Okay, we have one question.
Okay.
You wanna say it?
Being able to deal with the daily up and downs and not getting bogged down with the negative days.
Great.
That's the statement.
Yes.
Did everyone hear that? Well,
Maybe if you call
say that
it
again.
one more
Yeah,
time.
I'll repeat myself. So, being able to deal with the daily up and downs and not getting bogged down with the negative days.
Very good. Yeah.
Thank you for that
Thank
comment.
you for that. Yeah.
Very, very, very relevant and very resonates with what we ourselves have discovered in this
Yeah.
project. Very much so. Thank you.
And we have another statement from
Okay.
Bridget.
Bridget.
Resilience is the ability to cope. I did not have that ability.
Okay.
Okay. Thank you, Bridget.
Any
Okay.
more comments? Are we okay?
That's
Okay.
all.
Thank you. Thank you both. Thank you very much. Okay. So in this next phase of the webinar, we want to tell you about some of the things that we have learned from our own research. We want to tell you about what we found when we looked at what other researchers found. And we want to share with you the findings from our own research among family carers. Now, I should explain a little technical term here, if you'll bear with me. Researchers use the term intervention to describe any new method of carer support or a new resource that wasn't available to carers previously. And they refer to the effects of an intervention as outcomes. And researchers rarely say that one thing causes another thing. Instead, they write that one thing was associated with another thing. So, for example, they may write that carer training is associated with better coping. So we want to tell you in this next part of the webinar about some of the things that we learned from our own research, and we want to tell you about what we found when we looked at what other researchers have found, and we want to share with you the findings, as I said, of our own research among family carers. So we started by reviewing what information is already published on resilience and caring for someone with dementia. We found a lot of information out there, but we selected only that information which we judged to be of good quality to review and to analyze. We call this type of assessment a systematic review. We looked at a total of 91 different information sources, and we found that they could be grouped into three main categories. One, studies examining the context of caregiving and caring, such as the relationship to the person being cared for, the levels of social support, the time spent caring, and so forth. Secondly, studies examining social and cultural characteristics, things like age, socioeconomic status, education, and so forth. And the third category that we grouped these 91 studies under were studies examining the psychological aspects of caring. So here are some of the things that we learned from other researchers. And it's not possible to list them all given the time constraints of this webinar. Firstly, on the context of caring, the evidence shows that spousal carers experience more negative effects from caring. Living with the care recipient was associated with lower resilience. The time spent caring was also a factor. The lower levels of resilience were found the longer the time spent caring, and combining caring responsibilities with other family responsibilities increases stress levels. Under the heading social and cultural characteristics, the evidence suggests that having a better social support networks is associated with lower levels of depression. Using formal supports is associated with higher levels of resilience. Women are more likely to experience depression as caregivers. And also the evidence suggests that religion has a positive impact on carer well-being. And finally, the third category of articles and research is the psychological aspects. And the evidence shows that feeling in control of their situation and feeling competent as a carer was linked to resilience, while those with positive outcomes in caring were also more resilient. So in research, it is also possible to take a group of studies which contain statistics and to analyze all of these together. We call this meta-analysis, or as a form of high-level analysis. And we applied this method to 42 studies that looked at the effects of interventions on carer resilience. And we grouped the types of interventions as follows. Multi-component interventions, that is, interventions for family carers that included educational interventions, support groups, skill training, and so forth. And then there were the other type was just purely educational. And then also counseling, including individual counseling and family counseling. And finally, the use of alternative approaches such as meditation and mindfulness. And when we analysed the results of the studies, we concluded that interventions had generally positive effects on family carer outcomes. And the different interventions have different degrees of success when targeted at specific carer outcomes. Now, we also conducted a survey ourselves of just over 400 family carers of people with dementia. This survey aimed to examine carers' experience of caring for a person with dementia. We administered a questionnaire by post to the sample of family carers who were in receipt of a carer's allowance for the care of a relative with dementia. So we asked the Department of Social Protection to administer the survey questionnaire on our behalf. And this way, the questionnaires were anonymous. That is, we did not know the names or any details of the respondents to the questionnaire survey. Here is what we learned from the family carers' responses. The average age of family carers was 59 years, with the ages ranging from 21 being the youngest to 89 being the oldest. Half of the carers were aged between 46 and 64. 2/3 of the carers were female and 1/3 male. 2/3 of the carers were married. Well over half were a spouse of the care recipient. And almost 3/4 lived with a relative who had dementia. And most had not received any training for dementia care. Almost all of them, well over 90% of the family carers that we surveyed, said that it was their own choice to become a family carer. And most made the choice to become a family carer for many reasons, including the emotional bonds they had with the person they were caring for, a personal sense of obligation, a personal sense of duty, and because it made them feel good. And some chose to become a family carer because of the very high cost of professional care or because there was no alternative. In our survey, we also asked family carers about the kind of supports they receive if they needed to take a break from their caring responsibilities. Here's what they told us. Just over half of the carers said that if they needed a break from caregiving, they could find someone, but with great difficulty. Over 1/3 of the carers said they could find someone to help quite easily, but a substantive number said that they had no one that could relieve them from their caring responsibilities. And they said that the services most commonly provided for family care for a family member with dementia were GP services, public health nursing services, home health services, practice nurse services, and daycare centre services. And we also asked them, and we wanted to know what are the things that make them as family carers more resilient. And this is what they told us. Family carers who have a good or a high quality relationship with their care recipient were more likely to be resilient than those who did not have a good relationship with their care recipient. Family carers who make their own choice to become a family carer were more likely to be resilient than those who take on caring responsibilities out of necessity or not out of their own choice. Family carers were more resilient if the care recipient had fewer challenging behaviours, that is, behaviours that were difficult to manage. And family carers were more resilient if they experienced family support as helpful to them in their caregiving role. So, when we combine what we learned from other researchers and from our own national survey of family carers, what do you think is the most relevant facts to take home with you, the family carers of a person with dementia? What are the takeaway messages? Well, we know that resilience in family carers of people with dementia is influenced by many factors, including the individual carer's own personality and emotional responses, the social circumstances of caring, such as the living arrangements, and the levels of informal and formal support, and the stage of the family member's dementia. What seems to be important is the carer's own decision to become a family carer. So at this point, we'd like to invite you to respond to what we've presented in terms of the research. Can you relate to some of the research that we've presented here, both in terms of what other researchers have done and what we have found when we surveyed family carers? So we'll ask you to maybe type in one or two comments with particular reference to the information that we've shared to this point in the webinar. And we should say, just by way of helping you to think about it, in past workshops that we've facilitated, one participant mentioned that looking after your own health is important to being resilient. So would you agree with that, for example? Another person mentioned, without being emotionally connected to the person you are caring for, it is very difficult to cope. So what do you think of that comment? So we'll give you a few moments, like before, to type in your comments.
Any comments coming in?
None just yet.
None just
Okay.
yet. We'll give it one more minute. Yes?
Did anybody come back on the previous questions?
We have some statements from previous.
Yeah,
Yes.
maybe read those
I
out
can read
actually.
them
That'd
out.
be great,
Yeah.
Kevin.
Yeah, so we have one from a Helen. She left a lengthy statement. So she wanted to say that, like thousands of Irish people in the 80s, she left Ireland to go to the UK. She is still there. Her mother, who is 92, has dementia and is going to a nursing home tomorrow. She cares for her mother at a distance from London, from London to Dublin, which is exhausting.
Yes.
There's no close family here in Ireland. More and more immigrants face their parents or will face their parents in this condition. We do not receive carers allowance, nor should we. We don't pay tax here. So our resilience is anything but. I would like for us lost diaspora carers to be factored into thinking too. A small example, the local public health nurse is not allowed to ring me on my UK mobile, nor has she an email address she can use. I am reliant on her to listen to her answering machine. This is archaic in our day and age. If we have problems getting help from the Irish Health Service, I can't imagine how people with fewer connections manage it. Thanks, from Helen.
Thank you, Helen. That's actually a really honest comment, and I think in terms of a group that actually we haven't encountered before, the idea of diaspora carers, that's a really interesting point to raise, and one that I think you're absolutely correct will become much more relevant in times to come. I mean, everybody's aware of the crash and the amount of people that emigrated from this country, and I think it's only a matter of time before this particular problem becomes much more commonplace. And I think it's very important that it's raised and noted here anyway, and I really thank you for your comment. Jared did.
Yes, no, thank you, Helen. And really, it's something that didn't figure in our thinking. In fact, I'll be honest with you, and it's something that I think we'll take up that comment and maybe look and see what clearly there is something of a ban on engaging diaspora in this way, as you clearly explained about about it, your situation, but evidently it's something that is going to feature more, as Sandra has said. So we'll think about that one, and we may actually ask a few questions around the policy area especially, and we'll certainly share anything. And indeed, there may be a case for maybe another research study to look at the experiences of diaspora in terms of aging parents and so forth.
Thank you.
Thank you.
So we have another statement and a question from Anand.
Hi, Anand.
Caring for a person in a rural setting, I have really appreciated the support of neighbours and the local community. So that ties into another statement that was left earlier. Having a good support network, whether formal or informal, helps with resilience. And that's from Bridget.
Thank you, Bridget.
And from Niasa, I hope I'm pronouncing that correctly.
Niasa, yeah.
Being resilient for me being resilient for me means being able to cope with everyday problems.
Thank you.
Thank you.
I think that piece around community and having good support networks is really important, and I think it's something that's come up time and time again for us in the research that we've done. I think, again, the idea of community supports in a rural setting, I think, is a very important one to raise, and I think it's come up with a number of our regional workshops actually that we did that were outside of Dublin, where that would have been something that was quite prevalent for people as an issue, and being able to include neighbours and members of your local community within your own parish in the situations that you find yourself in as a carer was hugely important for people in terms of their resilience and their ability to cope with the challenges of caring. So I think that's a really great point to raise, and I'm sure that there are others listening who would be able to relate to the points that you're making. So I thank you for that.
Indeed.
So there's another statement from Claire Fair.
Hi, Claire.
Thank you, Claire.
Looking after your own health is very important. Making sure to have time to look yourself away from responsibilities is vital for the carer's physical, emotional, psychological and mental health. It could also help the person with dementia to have a change of people looking after them.
Excellent point. And I think when I move on, I'm going to talk to you a little bit in a minute about the resource that we've developed for family carers, and I think that was a huge aspect of the work that we wanted to try to sort of highlight, is the importance of taking care of yourself as a carer. And I think a lot of carers that we've talked with would say it can be quite easy to forget to do that, or to put yourself way down the list of priorities when it comes to caring, I suppose, in that sense. And the consequences of not taking care of yourself can be quite serious, for not only for the carer but also for the person with dementia. And I think that it's something that really needs to be highlighted and focused on. And again, with the understanding that it can be quite difficult to find the time to do it for yourself when you are caring for someone with dementia, but that hopefully the resource that we've developed, and I think that and the work that we've done previously to sort of look into the aspects that promote resilience, it's about trying to find even small ways that can help family carers to look after themselves and to mind, I suppose, their own physical and mental health as they go through this journey. So I think thank you again for that point. And I don't know, Jared,
I have nothing to add. That's very, very clear.
From Regina.
Hi, Regina.
I'm finding this so helpful, and this is opening my eyes. It will take a bit of practice to be able to concentrate, as I'm missing some information, as this is all new for me.
Okay.
So Regina, I think, is mentioning how this I may be wrong, Regina, but this may sound like it'd be something new to you. So this is something that may help you, which is good to hear.
We're delighted.
Yeah, yes. And again, Regina, if there's any information that you feel that you're missing that you'd like, please contact my colleague Kevin. Has his email up at the end of this webinar. So please do get in contact, and we can put you in touch with whatever services or pieces of information that you're specifically looking for. We'd be happy to help. So do get in touch.
Just a note to mention, Justin's after telling me that the mic isn't as loud as it could be.
Okay.
So I do want to emphasize to some that's listening that may not be able to hear, we will speak close to the mic as we're doing now, but it's also being recorded for future playback. So if you feel you can't hear us now, we'll be able to provide further video feedback in the future. So if you do have a question, don't be afraid to ask. We'll go through some statements and so on, and we'll be as loud as we can also. So we do appreciate that. It's an echoey room as well.
Yes.
Okay.
So we do appreciate that.
We'll raise our voices.
Thank you.
Okay.
Thank you.
Thank you.
Anything else, Kevin, or will we?
Let me see. There's a few statements that are saying that they agree with what's going on.
Thank you.
And this again, Miasa has said, I can relate completely. I think I am lucky as my dad doesn't show any challenging behavior. There is extra family help too. So there seems to be a few people that relate to the research.
Yeah, and I think that speaks to that piece again about, like, I think from the research we found that where challenging behaviours in the person with dementia are at a lower level, that obviously does impact positively on resilience. And then again, if you have a good support network, I think a good support network being the emphasis there,
Indeed.
that I think that really does feed into people's resilience. So I think that's great, Nasa, that you've been able to kind of recognise that piece as well. And I'm sure there's others out there that might be able to relate as well. But thank you for your comment.
Yep, so that's all the questions for that section.
Okay,
there.
thank you everybody for taking part in that question. So we're just going to move on now. So I'm going to talk to you a little bit about the resource that we've actually developed. So basically, based on the findings from the previous research work that was done that Jared took you through there, we basically wanted to develop a resource that could promote resilience among family carers. So what I'm going to talk to you now about is just how we went about that process and what we learned from the process. And then I'm going to talk to you a little bit about the resource itself. Okay, so we knew that we wanted to develop a resource for family carers, but we didn't set out with a specific idea in mind of what that resource would look like. And instead, what we wanted to do was to work directly with family carers themselves, and to sort of come up with something that would be designed by them and specifically for them. And that's what we did. And we call that, in research, we call that participatory action research. But basically what it meant is that we sort of co-designed this particular resource with a group of family carers. And that for us was a way of ensuring that the work would be particularly relevant to the family carer group that we were targeting. So I suppose from our perspective, the value of having family carers work with the research team has been really significant. Their input has brought the resource in a direction we never envisioned happening, and we feel that the quality of the work that we've done and the resource itself is actually better as a result of working in this sort of collaborative way. So I think we've learned that research is greatly improved by the direct involvement of family carers, and it'd be great later on to hear if people feel that that's the case. But I suppose I'll move on to the process itself. So basically what we decided to do was we invited family carers to take part in the family carer group. We called the group the Enhancing Carers Resilience Group, or NCARE group. And it consisted of 10 people. So 8 of those people were family carers and 2 were members of the project team. So we had a good mix. We had 4 men and 4 women in terms of the carers that we had with us. And there was a mix of experience. So we had 6 people who were caring for a parent, and we had 2 people who were caring for a spouse. So as you can see there, the aim of the group was to plan and design a resource based on family carers' own definition of resilience and ensure that the resource was available to as many carers as possible. So basically, over the course of, I'll just go back actually, I'll just tell you a little bit, just over the course of we had 11 meetings in total with the family carers. So it was over a year that we actually were working together as a group. And I suppose what emerged from those meetings was that for family carers, resilience is something that isn't infinite. And what we found was that there were 2 things that the group identified that really impact on resilience itself. And those things were fragmented and hard to access information on caring for a person with dementia and inadequate peer and formal support networks. So I suppose in terms of the information, what came up for carers was the fact that while there is information out there for family carers, a key challenge is trying to sift through all the various sources, the various topics that are covered within that information that's available. And basically people were saying it's incredibly fragmented across a number of different organisations. So you have things like Family Carers Ireland, Care Alliance Ireland, the Alzheimer's Society, the HSE, the Genio Project, the HSE's own campaign, the Understand Together, and then information that you might get from your GP or your public health nurse. And as a carer, it can be very, very daunting to have to try to sift through all that information and also try to sort of prioritize which sources of information you're going to sort of rely on, I suppose, at a given stage of your caring journey. I suppose from the next thing that was around the peer support piece there. You're okay. So peer support was something that came up a lot, and I think it's come up in the comments already from people, that having access to a good support network, and that can be peer support, and it can also be then formal support that people might get through some of the agencies we've just mentioned. But that for somebody who's caring for someone with dementia, it can be quite an isolating experience, and it can be very difficult to access that peer support or develop a good peer support network. But the value of that network was really highlighted by our group in the fact that it can really address those feelings of isolation, and it's also a really important way of sharing information. Peer-to-peer information sharing is hugely important to family carers, and that's something that I suppose we wanted our work to focus on. Mm-hmm. So what we developed, something to kind of address those two pieces that were identified by the group, and what it is it's an online resource. It's an online information and support resource that's for family carers of people with dementia. So information is mapped kind of along a carer journey, and that allows the carer to access this information as they need it at a particular stage of their caring journey. There's also a component within the site where we have a lot of carers sharing their own stories about caring for someone with dementia and offering tips and advice to other carers, and that will speak to the sort of peer support piece that the group are very keen that we cover with this particular resource. So essentially what we have is a one-stop shop that uses carer stories to provide information and support to family carers of people with dementia. The resource is called Take Care of Yourself, Enhancing the Resilience of Family Carers of People with Dementia. And as I said, it's an online hub of video and then sort of standard information content. And I suppose the unique thing about this site is that it is by family carers of people with dementia for family carers of people with dementia. So I think in that way, and it'd be interesting to see what you think yourselves, it should really resonate and reflect the experiences of those of family carers who are currently in the midst of their journey. So we're going to just take a quick look at the site now. So what I'll do is, and again, people can come back to Kevin if there's any problems with them seeing any of this information, but I'm just going to pop out of that slideshow there. So this is the site. I hope everyone can see that now. So as you can see, it's called Take Care of Yourself, and you see the images there just around. So it starts off with caring for someone with dementia, learning from the experiences, and there's a couple of sections that people can look at. Worried about how you'll manage, unsure about the next steps after a diagnosis, and then just that taking care of yourself piece that I think NASA mentioned was really important as a carer. And as I mentioned in the previous slide, we mapped the information using a kind of carer journey model, for want of a better word. So the group were very keen that people don't want to be overloaded by information, but at the same time, they do need to have it. So what we've decided to do as a group was to map it over this carer's journey. So as a carer, you can kind of visit the site and you can look at this journey from diagnosis, and it travels down then here to life after caring, and you can enter into whichever aspect of that journey that you particularly are interested in at a particular time. But I suppose the idea would be that you have the comfort of knowing that that information on the other stages of the journey that you're maybe not at yet are there for you when you do need them. So that's how the journey is modeled. And then I suppose just to tell you then about the video piece, which we won't get a chance to look at now, but I'd encourage people to get onto the site themselves whenever they get a chance and have a look at some of the videos that are there. But we were very, very lucky that we had a number of amazing people that came forward to share their stories as family carers of people with dementia, and these videos are available on the site for people to listen to. So we've grouped them again under the different caring stages, but I think you'll be able to see them yourselves, and again, you know, decide which videos you're interested in looking at any particular stage. It's slow to load here on our end, but you get the idea. So we have all these are all family carers who have shared their stories. I think there's a total of about 27 videos there for people to look at. and and it covers kind of all the different aspects, and a lot of it again is about that peer support piece, about people who've been there, who've been through a particular experience as a family carer, and offering their insights into things that help them to cope better with those particular challenges at those particular stages. So I'll just show you as an example one page. So this is the Am I a Family Carer page. I think that was the one I said I'd have a look at. So this is how the site kind of ends up being laid out. So you can see it's broken into kind of various different sections. So am I a family carer? You can see things about choosing to become a family carer, which I think is an interesting one that's come up in some of our workshops before. And I think Jared mentioned it previously in terms of choice, how important it is in terms of if someone feels that they have freely chosen to become a carer, that really can impact on their resilience. But I think what's also come up for us in a lot of the work that we've done is the things that can impact on people choosing to be a family carer. And I suppose a lot of our members were keen that people need to consider certain things before they take on this huge responsibility, and that's what this section here looks at. And we have a nice video from one of our carers, Rachel, who talks about the things that she thinks are important for people to consider before they take on the role of a family carer. And again, please feel free to have a look at the site in your own time. I appreciate it's difficult to do in a webinar setting. So, so again, these are just things about looking at aspects of caring, the different things that are available to people that they might not be aware of at the very outset, the types of care that can be provided, and what these different kinds of terms mean, and then looking after your own future. So I suppose, again, some of the site now is still being built, so we have a few bits and pieces that still need to be added, but they are coming soon. And I suppose that's kind of, I suppose, the site. I mean, we have an advice and support section here. Again, these are kind of key areas that people identified from the group that carers really need information on. So things like financial supports, and then I think looking after your own finances as well. I think the financial impacts of caring, as well as the health implications of caring, are things that people have asked for lots of information on. I know our carers are very keen to have information on that, and other carers that we've worked with have said those are things that are really important to them in terms of having accurate and up-to-date information on. So that's what we've tried to provide here on the site. So I suppose, I mean, at that stage, it might be just worth linking back in with those of you who are listening to the webinar to see if there's any kind of initial comments. Do people have first impressions of the site maybe, or?
So we have one comment from Antoinette.
Hi, Antoinette.
Simply says, the website looks great. Which is good to hear.
That's great, thank you. And I'd really encourage you, Antoinette, to if you have the link there for the site, to go and have a look, and we'd be happy to take any other comments or feedback that you have. You can pop them in an email to Kevin, and we'd be happy to take them on board. So, and the same goes for everybody else who's listening out there now. You know, please do take the time to have a look at the site and send us your feedback. I mean, are there more comments coming in?
So it's just the one comment at the moment, and
Okay.
as Sandra's saying, I provided the link there. It's takecareofyourself.ie. It's in the comment section. So if you want to have a look, you can go through yourself in your own time also. If you have any feedback, you can email me, Kevin, and I'll be, my email address will be available at the end of the presentation. So if you have any further feedback, you can send me on further in the future. So it's good to take a look in your own time, of course. But if you have any comments you want to make now, you're more than welcome to.
Great. I suppose, like, just some of the questions there on the slide, like if people have time to sort of briefly comment to say, do they think it would be useful or helpful to family carers as a resource? Again, things around like, yeah, would you recommend it to somebody else? I think that was something we really wanted.
Helen has a question, actually.
Hi, Helen.
Can I suggest you send this to London Irish groups or other Irish centres in the UK? This would have been hugely helpful to me last year. Thanks, Helen.
Thank you, Helen. That's Helen who made the comment about the diaspora carers again.
Yeah.
Thank you. That's actually a really good point, and I think something we need to start looking at is linking in more with the service providers in the UK, specifically to target diaspora carers. It might be, if you'd be happy to get in touch with Kevin again, if you have any more information around groups that you're aware of in the UK that do that type of work, or that sort of support diaspora carers, I mean, I'm not familiar whether such groups exist, but if you were and you had any insights that you'd like to share with us, that would be really, really helpful. But I'll definitely be looking into linking in with groups in terms of sharing that resource beyond to Irish carers that are outside the jurisdiction at the moment. Yeah. Thank you, Helen.
Thank you, Helen.
Anything else?
So that seems to be one or more questions. As it is a question, good time in Noel, thank you.
Thanks, Noel.
So Noel says, as my husband's carer, I have to a certain degree, have my head in the sand and hide behind ignorance of what is and not available. What is and what is not available. Your site will certainly help direct me as to what and how I should progress. I look forward to investigating it further. Thank you, Noel.
Thank you, Noel. That's really interesting. Yeah, that's really, really interesting.
Yes.
Thank you. Really appreciate it.
So Justin's after mentioning to me that there's a slight issue with the power in the table. So, and basically what we've heard from other workshops is that the actual website is quite useful and informative as well. From what we see from some of the comments, it seems to be that it's nice to see, it's nice to look at, it's simple to view, it's resourceful, it has helpful information from other family carers, where that's where the basis of the website was designed.
Yeah.
So if anyone else would have to have any further comments, would you find the resource helpful? Would you recommend it to a friend or a family relative? You're more than welcome to chip in your 2 cents and see, or provide some feedback. If not, you're free and entitled to have a look further at the website, and if there's anything you see of issue, you can also email me, Kevin, and I'll forward information on to Sandra and Jared, of course.
Thank you, Kevin.
Thank you. Yeah, I mean, I think if there aren't any more questions or comments, I suppose I'd just like to say that I think if people are interested, that the site, we've been showcasing the site, I suppose, at the workshops that we've done around the country. We've also done some work with some family carers, just getting general feedback from them. And I suppose what's been really positive is just similar to what people have said here before, that it's something that people would find really useful. That I think a number of people have commented that it's something that they wish they'd had. I think, like Helen said there, a couple of years ago when they were starting out. And I think that's something that obviously unfortunate for those people who didn't have it at the beginning, but for those that are coming online now as family carers, I think it's great feedback for us to get and gives us great confidence, I suppose, in the resource, and that it's something that ultimately is useful to family carers. I mean, that's ultimately what this has been about, is building something that's effective, that's useful, and that family carers are going to want to use. And I think that's something that we feel from the feedback we've gotten, that we're pretty confident that that's the case. And
particularly the fact that family carers themselves were so involved in first of all deciding what resilience meant, and some of you this evening in the webinar talked about what resilience means to you, and that's really very helpful, and it resonates with what our family carers group have also been saying. And so the website, this resource, is actually coming from family carers themselves, both particularly the ideas around the website and the areas of the website, but also the actual videos, the many video testimonials, the little stories that the family carers offer about their own experiences, which I think as family carers you will find some of the videos will, I'm sure, resonate with your own experiences.
So we have another question or statement from Claire.
Hi, Claire.
I will most certainly recommend this website. Many carers feel alone, overwhelmed, and forget that they need to look after themselves as well, and not to feel guilty about taking time off, whether an hour a day or a week every month, if possible. That's from Claire.
Thank you, Claire.
Thank you, Claire.
And I think that's something that's come up again and again. I think that guilt piece comes up a lot with family carers, feeling like either that you feel guilty if you're taking time for yourself, or also just feeling that there is just no way to find time to look after yourself, and your own kind of health and well-being becomes very much down the list of priorities. And I think it'd be interesting, there's some of the content on the video section of the site actually speaks about this quite well. That we have one gentleman in particular, Robert, who spoke about not recognizing, sometimes family carers find it really hard to recognize that they actually do need to sort of take care of themselves, as it were. And it's only when sort of an outside party nearly points it out to you that you're not really doing as well as you think you are. That it's that sometimes people only get to that point when things have gotten quite rough for them, and it's at that stage then that they start to try to look after themselves. But I suppose the advice that we would be giving, and that is given through a lot of the video testimonials, is that the earlier people start building in time for themselves as family carers, the better the outcome is for both themselves and the person with dementia. And I think that's really important to highlight. So thank you.
Thank you. So we're getting a flurry of statements and questions coming through now, which is good.
Great.
Good.
So Helen again, have you thought about using Skype or FaceTime to get carers to speak to one another, to use maybe as a support network? It strikes me that would be a wonderful asset.
That's a really great idea. I suppose from our perspective, it was difficult to kind of include something like that on the site, just purely because of the level of moderating and managing of it that would be required. But that's not to say that it's not something that could be looked at down the line. Again, depending on how the site progresses, and the level of engagement that carers have with the site, there's always scope for looking at things like that. I know things like Facebook groups are often used with a lot of the support organizations to try to connect carers to each other, and there isn't a reason why the site couldn't have something like that built into it. But from our own perspective, we just simply didn't have the resources to manage that type of activity on the site itself. But I think it's really important to highlight, and it is highlighted on the site, that connection piece for family carers is really important, that peer-to-peer piece, which I think is what you're kind of highlighting there, is really, really important. I hope that answers that.
So there's a few statements that I'll go through just real quickly.
Yes, please.
I'll just give you feedback. So, Bridget, website looks good on mobile phone, really easy to navigate and read. Could have used this 2 years ago, but will still help us out as I am still caring. So that's Bridget.
Thanks, Bridget.
And yes, again, really enjoying the webinar, and I will find the Take Care of Yourself really useful. I'm looking forward to checking it out afterwards, particularly the videos.
Thank
actually.
you. Great.
This is from Anne Redmond.
Hi, Anne.
Well done, guys. Very useful information so far. Website is amazing. Everest says, rather sorry, this is just a bit formatting issue on the questions. Pardon me if I mix up the questions. Poster advertising could be good to GP surgeries for this website.
Absolutely,
yeah.
absolutely, and that's on our radar as well. We've already been in discussions about plans in terms of the launch of the site and going forward next year, how the site will be promoted. There's a definite recognition that GPs and public health nurses are a key component to getting this site into the hands of family carers of people with dementia. So that's an excellent point, and one that we've definitely taken on board.
And finally, Regina, this looks great. It's just what I need. We'll take it a while to digest it.
Absolutely, absolutely, Regina. And I think that's the thing with the site, the carers are very keen that it is something that you can kind of sit down with over a few days and kind of, there's a lot of information there and there's more to be added. So I think it's important that people, that they do take the time to kind of digest it, I suppose, because there is a lot there, especially with the video content. I mean, there's hours of video, there's hours of video content there. So, I think it's definitely something to take your time with. But, and again, look, any feedback that you have, please do send it on to Kevin, because we'd be only delighted to get it.
So if anyone else would like to leave a top of their feedback statement, you're more than welcome. But as far as I can see, that might be the last few statements.
Okay,
there, so.
thanks everybody. That was really great. And I suppose just finish up maybe by saying again that the site is there, it's live for people to have a look at. We would absolutely love to get some feedback from people about it. So, if you're happy to send stuff along to Kevin, please do. I suppose the other thing was that there was a survey that was sent around as part of the reminder email, I believe, Kevin, was it? Yeah. So that if people do have time to fill it out, we'd really appreciate it. Any feedback we get is really helpful for us in terms of going forward and learning. This is the first webinar we've done as part of this project, so it might not be the last. So any tips or anything like that, just please send them along and fill in the survey, if you get a chance. I think that's that kind of.
Yeah, so just a quick thing to mention. Sandra mentioned that you got a reminder email with the survey link to attach to it. If you didn't get the email, I've actually provided the link there in the chat box. So if you want to click on that and you register, you can go in and you can do the survey. It should be live in the next 20 minutes as it coincides with the end of the survey. So it's available to answer, I think, for the next week. So you have plenty of time to go through it. It'll take a couple of minutes just to fill out. So Helen just wants to say, thank you very much for your replies. Much appreciated.
Thank you, Helen.
Thank you, Helen, for your contribution. We really appreciate
Thank you,
it.
Helen.
So I suppose just the summary there is just, I suppose, the resilience in caring for someone with dementia is what we were trying to focus on as part of this project. Again, the really significant and important role that carers have played in this research and in terms of how the research project has evolved over the 3 years has been hugely important and has really impacted on the output of the resource. And I suppose that the resource itself, I think, has great potential to be something incredibly useful to family carers and something that can support and enhance family care resilience, which is what we set out to do at the beginning. Yeah, and then the survey piece. So look, that's as much, I suppose. Yeah, I'll just leave that up, I suppose, at the end there. That's just Kevin's email address. Again, if people have any comments or if they need any information, I know there was 1 or 2 people who were looking for bits maybe of additional information, please do contact Kevin and the team would be only happy to get back to you with whatever information we can provide. I think that's...
Yeah, just to add on to that, Sandra, there's a few people that questioned or wanted to know, could you get a hard copy of the booklet?
Absolutely,
So
absolutely.
I think we'd just like to say again, if you want a hard copy of the booklet, we have plenty of them.
Yes.
You can email myself, Kevin, send me your address, and then I'll send that hard copy to you as soon as you can.
Absolutely. And you know, if you want one for somebody else, you know, you can send a couple of them along to you as well if they'd be useful. Absolutely, we can do that.
Yes.
Yeah, I think with that, look, I just want to say again, thank you so much for taking the time to listen to us today. We hope the technical difficulties didn't get in the way of the information sharing. But I really appreciate your engagement. I know it's not sort of maybe the easiest thing to engage with, typing in comments and whatnot, but so I really, really appreciate the people who took the time to do that. The comments were really insightful and really on point in terms of the work that we've been doing.
Exactly.
And again, any feedback that you have that you want to send on, please do send it to Kevin. So if there's no other comments coming through, I'm happy to close that out.
So if we're happy to close, we're happy to close.
Okay.
Thank you.
Thank you everybody
so much,
for joining
everybody.
our webinar. Thank you.